And what do you think is the biggest challenge that you are facing today as a leader?
Well, I actually think, I'm kind of getting to sort of the latter part of my career. And I'm thinking more in terms of succession
Mhm.
I've been with the organization I am CEO of for 8 years, but my concern has always been sort of the broader community. I've been working in home and community care for quite a number of years now, and the mandate of this organization that I work for is really to bring attention to the healthcare system about how well home and community care can works and how it can be leveraged for individuals. And never more has this sector been important when you think about the pandemic, the need to self-isolate, to receive care,
Mhm.
particularly for seniors. So I want to make sure that, as I'm thinking about my career, that I impact decision makers around home and community care as an option to the delivery of services in healthcare system. Canada, for many reasons, is not as progressive in terms of its use of home and community care
Mhm.
as some European jurisdictions, and there are many opportunities, I think, and lots of avenues for this sector to really help. I think about long-term care. The continuum of long-term care is to stay in your home as long as you could possibly be independent, and then
Mhm.
only enter a facility when you need to. As I said, other communities, other jurisdictions have really gotten that message really clear. So that I think is kind of where I'm parking my brain going forward and over the next few years. Just my concern about keeping this front and center with decision makers and government to be able to leverage this fabulous sector.
Finding your successor to be able to move forward your mission. Is
Yeah.
that?
Yes,
Yeah.
for sure. And encouraging people to think that careers outside of hospitals
Mhm.
exist and are very fulfilling, and really tap on the creativity and innovation
Mhm.
that many young people want to have and find in their careers. So that,
Right.
I think, will be a piece of work that I want to focus on over the
Mhm.
next few years.
Yeah, and it's so exciting because there's so much that can be done in the community sector, but yet all the attention is always on the acute care, the hospital. Do you have any ideas in terms of what can be done, now with the resources that we currently have, or what needs to change?
Yeah. Well, I mean, I think we're making our case that, certainly this pandemic has cost us a lot. It's cost us in human toil, it's cost us in lives, and recognizing that the delivery of community-based services is really very effective and efficient way of delivering care.
Mhm.
It's where most Canadians, most Ontarians, all of us want to be, and receive our care from the beginning of life to the end of life. And I think I think government and decision makers sort of understand that, but unfortunately, our sector has not had the evidence. We haven't had the research and the
Mhm.
some of the great pieces of evidence that really have sustained or supported why the transition is important, albeit the ideology is there. So in Ontario now we're starting to look at Ontario health teams, which
Mhm.
are sorry, local community-based entities delivering care to a population of people, local population of people. So that is just ripe for home and community care. I mean, we've been in those communities for over 100 years in some cases. When I think about some of the home care providers in that are members of our association, so I think our time is there,
Mhm.
and I think the impetus to try and now sort of look at how we're going to get out of this deficit that we're going to find ourselves in that post-pandemic might be an opportunity for governments to look at leveraging this sector. So I'm hopeful.
It's true. It's healthcare is so highly evidence-based, so we're always looking for the data to support our what we're doing, and it's harder to measure those things in the community sector in
It is.
home.
And
Yeah.
and there hasn't been the attention, let's face it, we are, we're very, very focused on acute care,
Mhm.
and have been, but I think things are changing. And so I am hopeful that we will start to see that happening.